Hi, my name's Charles Marsala. I spent 8 years on a city council, a term as vice mayor and a term as mayor, and ran for Senate in the year 2016. I'm coming to you from New Orleans in front of Henry Clay. Henry Clay was one of the great senators of all time for America. His system on taxation and tariffs is what we implemented to fund the infrastructure of America in the 1820s. Today, we have tariffs and many more issues we need to address. So we've created numerous topics on our YouTube channel and on our website to have those discussions. We know that the founding of the great country of America required great debate and smarter conversation. If there's something you'd like us to add, please let us know, and we'd be happy to add that topic to our playlist for future discussion. Please join us in the Smarter Conversation. Celebrating Cultures organized the content from our show into an app called New Orleans Insider Tours. Download the app to see views of the New Orleans skyline from various rooftop bars around the city. Go up to Rosie's on the Roof. It gives you a great perspective of the city. Welcome back to Awe News. We're with Admiral Brett Giroir, who's here in New Orleans to speak to the Jesuit class. Brett, worldwide, COVID and the U.S. play a part, and there's a thing called the WHO. Tell us about the WHO.
So the World Health Organization, people have heard of it, but it's an organization composed of, I believe it's 180 countries that come together, and it's fully cooperative. It's sort of like the United Nations, right, where everybody has their representatives there. There's an executive board, of which I was a member of. I was the official U.S. representative through the State Department, so I had sort of a separate position, but all related to public health. And you know, it's an organization where you have to have an agreement, right? You can't go in and tell China what to do or tell Nigeria what to do. It's really where you have cooperative, you have to work together to try to bring the world up. So before the pandemic, we had been working on something called the Global Health Security Initiative, which is really helping country by country to build our own capacity to respond to things. And a lot of it was in Africa with Ebola. So the last Ebola outbreak in West Africa, they were really able to sort of put that down before it got really big, like 2014, 2015. And then obviously with COVID, you know, the World Health Organization got, you know, was very involved and very important. And it's an imperfect organization because, you know, you got to collaborate, right? You can't force people to do it. But I do think it's really vital that the U.S. remains in the World Health Organization. You know, President Trump had threatened to withdraw, but even though that threat was on the table, I was fully involved. At every executive board meeting, we were putting in packages to reform the World Health Organization. And, you know, the president played his cards pretty close, but I think he was just holding out for leverage, because while he was saying we're out in a certain time, I'm proposing, with the full blessing of the president, reforms to the World Health Organization that would strengthen it. So I do think we need to stay in it, but it does need to be strengthened and revamped, particularly after this pandemic experience.
Well, I think what many people don't realize is that he was a real estate negotiator. And I think sometimes when you're negotiating a business deal, you're not a politician. So you might say things like we're out or this, and we saw that in other things where it's leverage. We got to get reform, and this is where we're going to start here and negotiate.
If you tell people exactly what you're going to do and when you're going to do it and how much you're going to spend, then there's no really reason to go. I mean, nobody goes in the car lot and says, that's my favorite car, it's my favorite one, I'm going to pay double the price for it, right? You don't do that, right? And he was, in those kinds of circumstances, whether it's buying oil for the Strategic National Stockpile or buying new Air Force Ones, which I don't know what kind of deal he got, but it was a tremendous one. But I do feel that with the WHO, he was really trying to get as much reform as possible, because reform was needed. You know, the WHO really need to upgrade its ability to, like, get into China very early when the pandemic started, and to get good advice and to disseminate that around the world. So I really enjoyed that. I did a lot of my work before the pandemic in sub-Saharan Africa, working on sickle cell disease there. Sickle cell disease is the most common genetic problem in African Americans. There are about 100,000 people in the U.S. Well, in sub-Saharan Africa, there are 300,000 babies born with it every single year. And unlike here, where people at least live to their 40s and 50s and are going to get much better, 80% of those 300,000 die before their 5th birthday. So we were making a global initiative to do newborn screening in sub-Saharan Africa to get those kids just on simple immunizations and treatment that could let them live 4 or 5 decades instead of dying when they're 5 years old. So that was sort of my main thrust in the WHO, and that's continued on. And if I go back to Washington, I'm going to pick that up right where we left it.
Great. Now, as far as living with COVID, COVID is still not over, and we still see strains coming through and everything. How do you think we best are going to adjust moving forward?
I think we need to continue to take the initiative because COVID, unfortunately, is not going to go away. Maybe in 10 years it goes away. You can't see that far in the future. But we're going to have these persistent new variants that come about. The good thing is that about 60% of adults have already had COVID. About 75% of children have already had COVID. We've got widespread vaccination, so the impact of those viruses are going to be less and less and less. So, it may be a cold, it may be a sore throat, but you're not going to see the really bad effects unless you're at a really high-risk group, right? Very elderly people, people with a lot of comorbidities. And for those people, we need to make sure that they can get tested and put on the oral medications, the one from Pfizer or the one from Merck very early, because that can reduce death and hospitalization by as much as 80 or 90%. So we're going to have to live with this. It's going to be at a low level, but it's going to be around, and we can't let it ruin our entire lives or our country. We have to get back to relatively normal, and live with it. And we have tools now. It's not like February or March in 2020 when we had no vaccines, no medicines, no testing. We have all these things right now, and so I think we're equipped to go to the future.
And moving forward, because we'll see other things besides COVID, other infectious diseases, do you see that we're going to have a better system in place moving forward?
Well, we could have a better system in place, and the reason why I say that is that we learned a lot of lessons, but we tend to forget pretty early, right? When the crisis is over, we kind of forget that there was a crisis, and we make ourselves happy until the next one. So I do believe that we clearly can be more prepared in the future, and I did write a book, and one of the reasons, there were really 2 reasons for writing that. I didn't plan to write a book, but about July of 2021, I started seeing a lot of books coming out from people who were never in the room, who had 90% of the stuff wrong, and I was getting frustrated, and my wife says, you really need to write your experience down because you have an experience that very few people have. So I didn't want to, but she locked me in a room for a week and made me think about it, and I did that, and it'll come out next year out of the Texas A&M University Press. I wanted to do a university press. Number one is I wanted to get the facts right and to tell stories about a lot of heroes that you don't hear about, right? Who really, the power of the individual people made huge differences in this pandemic. Real heroes that were below the radar, were never on TV, and they never got a shout out, or rarely did, but really made a difference. And the second reason I wrote the book is to try to put all the lessons learned in one place. And I don't mean like the little individual lessons about this technology or that, but the big lessons about how we need to interact globally, how we need to align our leadership structures in Washington, how we need to reform things like the CDC and the FDA. There are a lot of incredible people at those agencies, but the agencies as a whole did not meet the expectations we needed. So we need to change them and learn from that. So we could be very much more prepared. Certainly technologically we're going to be more prepared, but technology is only one thing. It's all about leadership and organization and resolve and will and cooperation. And we can make that much less risky. The successes we had were mostly because of great individual efforts of people who rose to the occasion. We want to make that as part of a system to make sure that that we're not going to fail, that our chances for success are very, very high.
Well, I sometimes think we had Operation Warp Speed, and there's a book about the aha moment. It seemed that there were moments there where you said, hey, why don't we move this process this way and we'll get this vaccine out months earlier? And we had never looked at those things, and once we do them, they seem so simple. And those are some processes that need to be changed, and I guess your book will help us look at some of these processes that need to be changed.
That's right, because you never know, as they say, your battle plan is expired the moment the first shot is fired. And that's true for pandemics too, but you do learn a lot. It's not so much the specific things you do, but how you approach them, right? Like, I know people here in Louisiana know FEMA a lot, and hopefully you got pretty good feelings about FEMA, but FEMA was never supposed to be involved in a pandemic response. But the president, I believe it was on March 18th, said we can't let Health and Human Services do this anymore, not because we're doing a bad job, but FEMA has the infrastructure. They have the national reach. They know, they have representatives all over. They have $50 billion in reserves for emergencies. So FEMA became the lead agency, and I went over to FEMA as part of the leadership group. So I was formally deployed to FEMA to run the response with 3 other people in the leadership roles. So FEMA should always be in the future. That was never in any playbook. But FEMA, if we didn't have FEMA, we couldn't have, they distribute supplies, right? That's what they do. They have all these networks. When we wanted to do drive-through testing, they said, look, we have this concept of a pod to deliver food and water. I said, can we reverse that? Instead of, delivering food and water, can we make it vaccine sites? But use your essential playbook about who provides security, where this has to be, where the locations. And they said, sure, we can do it. So literally we said, that's what we're going to do. We're going to use the FEMA points of distribution pod system, but reverse it. We're not distributing anything. We're going to be taking tests. And of course, there's a lot of stuff to go into making the tests there. But a lot of those things that we learned that are just practical, like FEMA being the lead federal agency, using their infrastructure and their processes that are used every year, right? In Louisiana, California, wildfires, hurricanes, tornadoes, everybody knows the FEMA system. Let's plug into that. And that was really, really important.
Well, and here, the National Guard played a big role. They set up, like you're talking about, one of those pods, and it was so well organized at UNO campus where you could drive through and get tested. And I guess the security of not getting out your car and being your infecting anybody else. Yeah. It was amazing watching how those young men and women were sitting there and organized that so well.
We literally planned that whole national system in 72 hours. Because I got tapped on March 13th. It was on a Thursday. On Friday, we were in the Rose Garden, and the vice president says, we're going to have a national system of drive-through testing, and we're going to tell you all about it on Sunday. It's like we didn't have anything, right? So we went back. Everybody went to my offices at HHS. We worked around the clock. I brought all the officers who had been to the Diamond Princess, testing all those people there and rescuing the Americans back, brought them all there. We devised this system. We had FEMA there. We had my officers there. So FEMA had the pod system concept. We had my officers to put it together. I was calling up everybody like LabCorp and Quest saying, look, you don't have a contract, but in a week I'm going to start sending you 100,000 tests. I sent a C-17 to Italy to pick up swabs because a major shipment, there was only 2 suppliers, one was in Italy, sent a C-17 over that Saturday night. The chief operating officer and the chief health officer of Apple calls me on Saturday night, want to know what they can help. I said, yeah, we need an app to help people, and I need it in like a week. Or 10 days, and they came in and did that. And then on that Monday, so Sunday night, I went up and I said, it's not fantasy, we're going to have it. We have 41 sites. New Orleans was one of them. On Monday, we did a mock site, and we did it on a military base in Maryland so nobody could see. We had drones overhead. We had role players. We did the mock site, really played it out. And on Thursday of that week, we started our first sites. Because we had to, right? We had to.
It is, I guess. Thinking back to knowing you in high school and in military, I mean, you were a leader in ROTC, and I'm seeing you now do all these things that you did 40-something years later. It seemed like you had the genetics and you were ready and the training to implement these amazingly fast applications.
Part of it was that, and part of it I do credit to being an ICU physician.
Yes.
Because, as an ICU physician for children, there are times when you have to make decisions with imperfect information. Because if you don't do anything, the child's going to die. So you take everything you can, you bring it all together, you do something, and you monitor yourself. Like if if you do something and the child's not getting better, you know that from monitoring the child. So nobody ever feels comfortable with making big decisions without all the information, but sometimes you have to, right? And you have to reassess it. So I think that kind of training to be able to not be paralyzed by the lack of perfect knowledge was really, really helpful. But always being honest with yourself that you could be making a mistake, and you got to put systems in to say, if we're going in the wrong direction, I need to know about it and not be wed to my earlier decision. If you got to pivot, you pivot, and that's what we did. And public health service officers, I mean, you know, they are fantastic because every one of them have been deployed to hurricanes, wildfires. You never know what you're going to see, right? So they were all. We sent a rescue mission to Japan for the Diamond Princess. And I think it was one of the best moments. So when we evacuated the Diamond Princess, everybody returned home. But I got called from my captain, you know, a Navy officer, public health service captain, which is like a Navy captain in '06, so it's an experienced person, saying, I got 53 Americans in the hospital. Are we going to pull out? You know, because everybody's, and I said, we're not leaving 53 Americans in the hospital. You stay there. And I'm going to leave a team of 10 people, and I'm going to send the top, my 2-star Admiral, top clinician from NIH over there. And I don't know what you're going to do, but you're going to stay there and you're going to organize their care. And we're not leaving Japan until every single American is out of those hospitals. And we did that, and we brought every single American home eventually out of those hospitals, including elderly. We actually got early experimental care for them. So, like I said, you don't know what to do, but if you get the right people with the right mindset who are trained, like that group that went to Japan who did incredible work bringing all those Americans home, you know, then you'll do okay. And I think we did.
Now, today we still have several other issues going on, and one is opioids. I mean, and you involved with that. I mean, do you feel that there's anything that from COVID can apply to helping us with our opioid situation?
Boy, you know, it's really tough because COVID really hurt us. We were starting to make inroads into opioids. You know, the deaths were going up, and that was mostly from prescription drugs, right?
Right.
Because you know, and a lot of people were at fault with that. But if you'd go in with a little pain, you know, when I was in medical school, we were taught if people were in pain, you know, opioids weren't addictive. That was sort of the doctrine. But they're really addictive, and especially things like oxys. And once you're on it, within a few days, you can be physically dependent, meaning that if you go off of it, you go on withdrawal, and it doesn't take very long to rewire your brain to have a craving that you'll give up everything to get that. And it's a disease, right? It's not a moral weakness. It is a disease.
Yes.
So we sort of got that turned around by getting prescriptions right, but at the same time, cheap heroin started coming in. And when people weren't getting their prescriptions and they weren't getting treatment, they switched to over-the-street heroin. And that started the heroin phase. And then we all know about fentanyl now. Fentanyl is much more potent than morphine, much more potent than heroin, and it can be made synthetically, means you don't have to grow it in a poppy or anything. And, you know, 1 pound of it is enough to kill, you know, half of America. It's really that potent. It's really a drug for ICUs and operating rooms. So COVID put people back in despair. A lot of them didn't get treatment for their underlying problems, so the mortality rate started going up and up and up. So I would say a few things we learned that we have to expand upon, not just for opioids or methamphetamine, but for a lot of things, is that telemedicine works. Okay, and people like telemedicine. You know, it's a long haul, you know, driving 50 miles and going to, or even going 2 miles and having to get in a big medical center, when a lot of things you could do over telemedicine, over your phone with the video. And we also learned that during that time that teleprescribing, like for medication-assisted treatment for people who have substance use disorders, it works pretty well, even with telemedicine. Something like 30% of all federally qualified health center visits were by telemedicine, and up to 80% of Medicare enrollees did something with telemedicine. So I think one of the things we need to do is realize that we got to bring healthcare to the people in their home, not have people in their home travel and have all these barriers. And it's a foreign environment. I hate going to the doctor. I hate going to hospitals. Can't find a place to park. You can't find your way around. It's very expensive. If we could bring, like we did testing to the home for COVID, if we could bring telemedicine, that's going to help opioids, but it's going to help heart disease, cancer, diabetes, smoking, all of that. So that's one thing that I'm hoping we build on, and I'm trying to do my part even now to help build that. Pretty soon, as Amazon said, you're going to be able to say, Alexa, I need a doc, and you can have a telemedicine visit just arranged by Alexa. And I think that's a real positive thing. You're always going to have to go to the doctor or to the pharmacist, or for some things, but for a lot of things you can handle in the home, and we need to do that.
Well, oddly enough, I actually have some real estate in Silicon Valley, and I have a telemedicine company that rents from me. And so I've been paying attention to that because the laws had to change to allow the doctors, I think even billing, that a doctor couldn't bill if he was doing telemedicine. I think some legislation that had to come into play.
Well, a lot of things, and this is very important, it gets kind of deep, a lot of things happen because of the public health emergency. When there's a declared public health emergency, it allows the federal government to relax legislative restrictions to allow things to happen. So a lot of what you saw is because of the public health emergency that the Secretary declared that. Under the PrEP Act, which is under my authority, the only reason why pharmacists could do testing, the only reason why they could give childhood vaccines, the only reason why they can give COVID vaccines is because I wrote an order to allow that because of the public health emergency. But once that's over, it could all revert back. And most of the enabling authorities that allow telemedicine are because of the public health emergency. And we have to tell our Congress people and our representatives that we want this permanent, right? We want people to be able to do services for telemedicine. In a limited degree, we want them across state lines, right? Because it's not so much here, but in New Orleans, but if you're on the border in Mississippi or Texarkana, the borders don't matter, right? I mean, it's not a border issue.
Right.
So contiguous states kind of stuff, these are all easy things. And I think pharmacists, I'm a big fan of pharmacists. They're really well trained. We need to empower them to do more because people trust their pharmacists. There are pharmacists in every community. Everybody goes into, CVS's.
Yes.
I don't know if KB's is still here, but you go to Katz and Bestoff's, you get what you need. Everybody knows that in their community. And we have to allow the pharmacist to participate more to help people in a convenient way, right? In a convenient way that people can get what they need.
I have a lot of family in Monroe. And I mean, that drive from New Orleans to Monroe, you've got a lot of farmland. And I can't imagine what it's like if you're on a farm 60 miles from Monroe, which doesn't have, say, the medical facilities of New Orleans. And you have something, you could lose 2 days going to see somebody.
No question, no question. And when it's hard to get in, then people delay until they're really sick. And that's what you want to avoid. Once you're really sick, it's hard to get yourself back in shape, particularly among the elderly or people with diabetes or COPD, chronic lung disease, all those kinds of things. So I think that's one thing for the future. One thing we learned, I think we learned many things, like the public-private partnerships are important, but in the delivery of medical care, telemedicine is a really good thing, and people like it. If you look at surveys of people who had telemedicine, it's well over 90% of people said, I want to do more things this way. And getting care to people, like either in the home with testing or in pharmacies where it's convenient. These are things that I think we need to build upon and build the next generation of the healthcare system that keeps people healthy instead of just treats them when they're really sick.
Wow. You're speaking today to the Jesuit seniors graduating. What is your thoughts about, you tell a senior, not only a Jesuit, but throughout the country? What are your visions as far as lessons in life, and how do you look forward to your life after graduation?
Well, I'm talking really for a Jesuit audience right here. And the two things I'm going to tell them, because you can't tell seniors very much, they don't remember anything, and they may not remember two things. But the first thing I'm going to tell them is that your Jesuit education, and I'm going to call it your Jesuit enlightenment, will always be with you. And sometimes it's going to be real obvious, but you're going to go through some dark times in your life. You're going to go through some times that are stressful, maybe in your family, in your church, in your hospital, in your leadership role. And you can always summon those core principles you learned at Jesuit about being humble, being a man for others. You're here for service. The ideas of discipline and hard work, camaraderie, leadership. All those things you could summon wherever you are forever, because they're emblazoned in you, and you got to know that you can call on them. So when things get bad, you go down deep and you can bring that experience. And the second thing I'm going to tell them, and again, it's a religious audience, is that God has a plan for you, and you just got to be open to it. because sometimes it's crazy. Like, you know, why would I possibly leave my tenured faculty position at an academic medical center with a great life in Dallas with my girls in private school and go to DC? Well, the opportunity was there. I thought about it, my wife and I prayed about it, and it seemed like the right thing to do, so we trusted it, and things do. So God has a plan for you. You got to be open to it, and it may not be the road, you know, you think ahead of time.
Yes.
But, you know, there are going to be opportunities, and I think your life is like that too, right? You've had more different careers than I've had, right? I've sort of been a little bit in the same space. You've done so many things, but you wouldn't change a thing, right? Because it brought you to the right place. So be open to opportunities. Don't think you've got it all figured out. You know, sometimes like you know that joke about Boudreaux sitting on the top of his house after the flood, right? You know, the water's coming up, and he's praying to God to save him. And all of a sudden, a guy in a rowboat comes up and said, "Boudreaux, get down." He says, "No, I'm praying to God to save me." He said, "Okay," and he leaves. And then a guy in a motorboat comes up. "Boudreaux, get in the motorboat." "No, God's going to save me. I'm praying to God." Helicopter comes. You know, "Boudreaux, get in the helicopter." "No, I'm not going to get it because I'm praying to God to save me." So Boudreaux drowns, right? He gets up to heaven and he says, "God, you know, I've been praying to you. I've been a good Christian my whole life. I prayed for you to save me." And God says, "I sent you a rowboat. I sent you a speedboat. I sent you a helicopter. What more do you want me to do?" Right? So, you know, sometimes you got to be like that,
Yes.
that there's a message coming to you. Just accept that and go with it.
Well, and that's what somebody told me years ago. You pray to God, the message comes, but you have to receive it. You can't, it's almost like having your radio and not having that message come through your radio. This is what you need to do, but having it turned off or just keeping driving and not paying attention. So I totally agree with you. That is a great message to give. And Jesuit is so blessed, but the country is so blessed because you took and responded when you got that opportunity that God offered you to go there, because I can't imagine the results would have been had not we had the fast response that you brought to the table in D.C.
Thank you.
So thank you. All right. That's been a great show. Admiral Brett Giroir, my classmate.
My wingman.
Wingman, exactly. It's been great catching up with you, and I look forward to a great luncheon and look forward to seeing you back in New Orleans many times.
Fantastic.
Great. Thank you for watching this episode of Awe News.
Hi, welcome to the YouTube channel of Awe News, where we celebrate community heroes, people who are working to save the environment, endangered species, to help homeless youth, and take care of our veterans. And we also highlight social philanthropists like Mr. Waldenberg, who left his estate, which funded this 14-acre park and numerous educational programs for children. Please subscribe to our channel and look forward to our shows appearing on public broadcasting. Our News spent 5 years touring Louisiana. We've interviewed countless numbers of people. The people that make it happen, that put on Mardi Gras, the chefs, the artists, the backbone of Louisiana. We've taken those interviews and made a show called Celebrating Culture. But we've also taken those interviews and put them in a tour app, New Orleans Insider Tours. To download the apps, all you have to do is point your phone at the flow code in the camera mode. Once you have the app downloaded, you'll have access to putting together the best game plan to experience in Louisiana. New Orleans and Louisiana are must-see for everyone, and there's so much to see. So we hope you enjoy it, and as we say here, let the good times roll.